Yeah, my name is George Niendekwa. I'm the District Program Officer for Health Communication Partnership, that is in Southern Province. Looking at the interventions that we are putting in place as HCP in Choma District, for instance, our aim is to make sure that the community groups that we are networking with, they try to tap some of the tools that we are trying to offer to them. For instance, like the capacity building training we give them, we take them through the process of helping them identify their own health problems within the community, coming up with solutions, developing community action plan. That in itself is a skill which we hope that our NHCs, the CBOs, even theatre groups can use to solve their own problems within their communities. Hence, helping them to break the dependence syndrome. That instead of them to look up to the outsiders for help, but they can use their own local available resources and solve their own problems.
Before the training, we were just doing things at random because there was no good direction on what to do. Now after the training, we were guided because we knew what was supposed to be in place. But before that, we are just doing things according to how we could understand it. But after the training, now we knew the direction of the NHC.
Twakaluka akupeleha baba mamemba ba NHC baliko kuno akupa sakuba pandruda mbuli muthu akasangula kwiya pona nthu akamala kupa pandruda bakapola ba pandruda kuno bantu ono bakachiyanda pona bakakhala anthu omwe kuti bahonwe yotujisi tubayishe tubuke tukwehera anthu omwe tumane twakatyani twakakhala twalanga malwazi twakali malwazi ali 5 pona uzwa malwazi ali 5 twakajana malwazi othatwe alo aya agali kuchisama ningi mulimbo bamba bache person ya malaria, diarrhea, HIV and AIDS.
Then the last day of the training was specifically set aside for a field visit, where before we do the training, we identify one NHC that is doing very fine. That is in the basics of trying to mobilize their communities to do activities on health. So on the last day, we will visit one NHC that is doing very fine for others to see, so that it can act as a catalyst, so that when they go back, they are able to implement what they saw.
First, pamene tunayamba ba HCP wanabula watitenga ku workshop. So tunaenda tapunzirako mosungira ndrama na ku field work vanatipelekako ku ZESCO muzuma tunaenda taonako banzatu bamene bachita na mwamene ba support ma orphans. So na ipo tinakata kala na idea kuti naise tingachite hivi.
So andichinatukonderesa tinaona kuti kansise bazimai sitiyenera kuzilekelela kunkhala chabe. So since tinaenda mukupunzira kubanzatu vamene bachita kuja lero tinayangana kuti kansi naise muno bali na matenda aya TB, maorphans tilinabo, mawidows tilinabo, manje mphamvu futi tinazo nanga chameti ngalepele kusebenza ni chani. So yes naise kansi naise tifike pati.
Nachinangu magarden banzatu bali maningi magarden. Bali na minda ikulu maningi ya magarden. So chonse chije chinatigwira ku mutima naise. So tati setienika kuchira paja pali bevi. At least setingale pasogolo. Kukumbwira kuja kusile.
So did you do better?
Yes.
Twakawona kuchinja maningi mukuti bantu bataya kulibwa bila maumabo.
Ponya mandeso twakatalika kuyisha bana bahonto ibukirini obelede kubamba bana babo utali kutetwa ku toilet ubweza buyonka panzi watalika kunywa ngajipa urazi kwa kusomona wedeti kakulika kumbulika menda ponya mwana azwa ku toilet asambe mumatanyi katane ataja kulya ponya twagayisha
mumunzi mwamwe ntenga imuga entunga wagiswakata natwarwa ku clinic mbayirete kugwabirirwa uyerete kugwabirirwa amuntu oyo wagabikwa gute wagayishigwa mane gosiga ku clinic.
People have realized that there is need to have mosquito treated nets. Now the demand is so high, so much that we are even failing to meet their demand.
Adi bambiri bakumbwira kwa ino ntawo ma community enangu bakamba chabe pa mulomo kuti titandizako maofanzi tichitako vili so vamene sivichitika manje pali yatu bayangana na manso avo bazionera vamene tichita.
These days maofanzi wapaka maningi so kapena sakapa tainza kutanga ma days so na mwenye nzasiri za school at least iliko mushi at least support iliko ma support ako pasa ko mabuku ma pencils school fees na vinango vina.
Already some communities who have been here for, this is our second year operating in Choma, and some communities are already giving testimonies of standing on their own. We have ZESCO Munzuma Neighborhood Health Committee. It's about 20 kilometers from the Boma. Right up now, they have reached a stage where they are now building their own community school. They are planning to build their own clinic, and they were testifying that even if HCP was to leave now, we can still do things on our own and even do them better because we have reached a stage where we can stand on our own.